Hello everyone, welcome to Nursing 5052, Financial and Health Policy Management. My name is Jeremy Howell and I am your instructor for the rest of the course. So first, welcome if you're taking a look at the weekly video here. To get things started with, I should introduce myself. Again, my name is Jeremy. I live in Eastern North Carolina, so not too far from Bluefield College, about 5.5 hours. I am active duty in the Navy, and I will be retiring in about 3.5 months, so really looking forward to that and getting into full-time academia work. So I'm a healthcare administrator by trade. I've been in healthcare for 20 years. I've done everything from being a human resources department head, a compliance officer. I've been an aide to the Deputy Surgeon General of the Navy. Been all over the world, seen lots of cool stuff, but my family, I am married, been married for nearly 15 years to my wife Casey. We have 2 kids, Riley and Brody. Riley is going to be 13 and Brody is going to be 10, so they're ready to settle down and stop moving every few years. And so I said, that's it. We're gonna, Jeremy's gonna figure out what he wants to be when he grows up. So after 20 years, I'm happy to be retiring, but I'll definitely miss the armed forces for sure. It's been all I've ever known since I was 18, so it's been good. So this week we're going to be talking. We're going to start talking a little bit about reimbursement. So you're going to read through chapter 3 of your textbook. Doesn't get too heavy into reimbursement, but it does mention reimbursement. So I did post some articles for you in the virtual classroom that you can use to assist you with this week's assignment. So please take a gander at those articles and they'll really help you get started, because you're going to pick a reimbursement method and you're going to discuss that reimbursement method, the pros and cons of it, and some of the ethical concerns that surround that reimbursement method, in which with each reimbursement method, there are ethical concerns, there are challenges that do exist as we try to, put our minds around how we can improve healthcare. So in this little mini lecture here, I'm going to talk about the financial organization of the U.S. healthcare system as a whole just a little bit. Then we'll talk about just a few reimbursement methods. Some you may be familiar with, some you may not be familiar with. You may have not heard any of them at all. So that's what I'm here for, to give you a little bit of insight into that. And if you have questions at the end of the lecture, please shoot me a note and I'll be more than happy to go over it with you. All right, so the U.S. healthcare delivery model, it's quite interesting, right? So it's different than any other industry out there. In no other industry do we negotiate with a third-party payer to pay our bills, right? We don't say, hey, I want to go buy a refrigerator, so I'm going to go talk to the middleman who's going to negotiate with Lowe's or Best Buy to try to get me the best deal. But I'll pay him a premium, every year just in case I need a new refrigerator or it goes out. And so healthcare is quite unique, right? So here we've got, now hopefully you can see my mouse on the PowerPoint here. But here we have the producers, right? Those are our providers, our nurse practitioners, our physicians, our physician assistants, any other provider that might provide care. They're going to provide us, the consumer, with medical services. We in turn pay that provider with out-of-pocket expenses, right? So that could be a copay, for example, or we just pay cash. Well, most Americans have insurance, right? So either they have employer-sponsored healthcare plans, which we receive in the form of lower wages. They get a tax break. Or we pay our insurance company directly, right? Or our employer pays our healthcare insurance directly in premiums. They in turn give us health insurance coverage. Our provider then will make a claim. The insurance company may or may not send payment, obviously depending on whether or not that we qualify for the services that are being rendered. And these folks are called our third-party payers. So this slide, it just intends to depict our U.S. healthcare system and how crazy it is, right? And it kind of shows you just a little bit how financing occurs. Now, for reimbursement methods, there are various methods. Such as, down there you see 2 broad categories: fee-for-service, capitation. Now we have value-based reimbursement. I'll talk a little bit about that in a second. But there's a driving force in our country behind reimbursement, and that's Medicare, right? The Centers for Medicare and Medicaid Services. We don't have one set entity or group that manages our healthcare system as a whole, but Medicare they try to do a good job at trying to govern as much as they can, which is through legislation. We have fee-for-service predominant form of reimbursement before the 1970s. Whoops, something popped up on my computer here. So before the 1970s, with very few exceptions, fee-for-service was the dominant method of payment in the United States. Now, initially, providers were paid cost plus 2%. And it was, they put down a list. I did this for you, so I'm going to charge you for this, and so forth and so forth. That was fee for service, right? Based on this assumption that healthcare is provided in some set of identifiable and individual distinct units of service. And providers like fee for service because they're going to get paid for exactly the services they provide. But there are some challenges to that because there is an incentive to deliver services that might not be necessary. Capitation, it attempts to reduce cost, right? It attempts to reduce costs because what it does is it gives, the HMO, the health insurance company, whatever, says, hey, doctor so-and-so, nurse practitioner so-and-so, here's $20,000 to treat these 20 patients over the course of a year. You go over that amount, well, that you're going to come out ahead for that. You're able to create efficiencies and utilize your resources efficiently, and let's say that patient care costs only cost 16 grand, you can keep the difference. So it attempts to reduce costs by ensuring that providers really only provide the right care for the right patient. It establishes these financial incentives. A fixed fee regardless of what's going on. But there's some problems to that, right? We don't know what walks through the doors sometimes. And so that can be a little bit of an issue. And there are some challenges with capitation too, because sometimes there is a belief that providers might withhold necessary care in order to save money. Value-based reimbursement, relatively new, right? The Patient Protection and Affordable Care Act of 2010 kind of really started to bring forth this concept of value-based reimbursement that ties payments for care delivery to quality of care. So here you see we have better care coordination, easier access to price and quantity rates, so price transparency. This form of reimbursement has really emerged as an alternative, and some people are hoping as a replacement to fee-for-service. So value-based reimbursement, as you'll learn through this week and you'll learn through the course, it's becoming more and more popular, but there are some ethical concerns to value-based reimbursement as well. There are challenges to value-based reimbursement, and I'll post some articles. I think there's some articles for you in the virtual classroom as well for that. But that's all that I've got. Again, trying to keep this short and sweet. If you have questions, reach out to me. Again, I'm Jeremy. Great to meet everybody, and I'll see you around the classroom. Ciao.